Luca Dorigo, cryotherapy expert, educator and strength and conditioning coach, and today I'm going to show you what it's like to undergo a cryotherapy treatment, discuss all the processes involved and all the forms of cryotherapy. We'll also discuss why cryotherapy has become so important to elite athletes and all those suffering from a wide variety of injuries, from post-surgery rehabilitation to joint problems such as rheumatoid arthritis. So what is cryotherapy? Cryotherapy is the umbrella for all cold therapies. There are three possible forms of cryotherapy. The first being cooling, which is used to restrict acute inflammations, ideally within the first 10 minutes. This is using things such as ice packs. Secondly, you have cryosurgery, which is the destruction of tissue, such as using liquid nitrogen for the removal of skin tags, warts and moles, and then cryostimulation, which is the use of extreme cold vapours to sufficiently cool the tissues in order to trigger a vasomotor response and hormonal release. So today I'm going to be going into a Cryosauna, which is a partial body single man cryotherapy unit, and we're going to look at the possible forms of cryostimulation. Generally, cryostimulation is often referred to as cryotherapy, which is why we have the cryotherapy banner here. Local cryotherapy is the first form. This is using localized devices which spray a specific stream of nitrogen or CO2 onto a targeted area of the body. Localized cryotherapy units will only use CO2 or nitrogen. Partial body cryotherapy units will only use nitrogen. Partial body cryotherapy units are single man cabins which go up to shoulder height, so the head is outside of the cabin, and they have a systemic response in the body. So they're very good for chronic injury, muscle recovery and autoimmune illnesses. The third form of cryostimulation is whole body cryotherapy. These are cryochambers. A cryochamber consists of two chambers, a pre-chamber which is minus 60 degrees and a main chamber which is minus 120 degrees or colder. In the pre-chamber, the client will go for 1 minute to adapt to the cold temperatures, and then the client will move on to the main chamber for 1 to 2 minutes for the rest of the treatment. Cryochambers are very good for systemic responses and also very efficient for muscle recovery, autoimmune illnesses and chronic injury. This is why so many athletes worldwide are using this therapy to support their training and recovery. So what are the processes involved in cryostimulation? Firstly, the patient is exposed to CO2 vapour, nitrogen vapour or synthetic air during an optimal time frame to cool the tissues down to an optimal temperature range. When the tissues are cooled sufficiently, the patient will experience a dull ache in the treatment area, and this is the constriction of blood vessels. This is known as vasoconstriction. Off the back of that, the patient will experience vasodilation, which is a metabolic surge which will last for several hours. The patient will also receive an analgesic response, which will give the patient less pain, increased range of motion, and increased metabolic processes, which in effect will heal an injury much faster and more efficiently. So for those of you wondering why I would attend a cryostimulation treatment, here's why. Firstly, cryostimulation inhibits inflammation, meaning that it reduces levels of swelling and inflammation throughout the body efficiently. Secondly, cryostimulation provides a powerful analgesic response due to the release of noradrenaline and B-endorphins. B-endorphins are feel-good hormones and the body's natural morphine, meaning that the patient will feel an elevated mood and reduced symptoms of pain. Other benefits from cryostimulation are increased range of motion and increased rates of healing, meaning that the patient will experience shorter rehabilitation periods. Therefore, cryotherapy can provide a strong support for rehabilitation programs such as treating chronic injury, rehabilitation programs for postural rehab, improving flexibility and also muscle recovery. One of the most popular questions which I receive regarding cryostimulation is how it differs to an ice bath. Firstly, they're both cold shock therapies. They're very similar in their bodily responses, but cryostimulation was developed so that it is much more hygienic, more efficient and faster. Because it is using dry vapours at extreme cold temperatures, it's a much more sterile environment and there's much less risk of tissue trauma. Because of this, it is also much more comfortable for the patient to attend a cycle of treatments and therefore follow through with the therapy. So when should cryostimulation be used? Cryostimulation should be used in the post-acute and chronic stages of the injury and also throughout all of the rehabilitation process of an injury. Cryostimulation should also be used 1 hour after exercise-induced inflammation because this is an important anabolic window, so we should wait during this period for optimal results. Cryostimulation is also very similar to working out, where the more you have the treatments and you use it in an accumulative manner, the more that you're going to gain a benefit. So the vascular network becomes more efficient and all the body's systems also become more efficient. Therefore, you gain the best results from the therapy. So here I have a local cryotherapy unit. Local cryotherapy is used to target specific injuries with a more precise stream of vapour. This gives the body a more intense response and therefore is better adapted to specific injury. This is a CO2 unit using CO2 vapour at -78 degrees, and I'm going to show you an example of how a treatment is carried out. The combination of high energy output and extreme cold temperatures cools the skin to the optimum temperature range, activating the blue light to indicate that thermal shock has been triggered. This is the stage when the patient experiences a dull aching sensation. Rapid vasodilation follows within a minute post-treatment and the patient can experience a superficial red glow momentarily. Gradually, the internal temperature of the treatment area will begin to rise across the next 4 minutes as thermal shock takes full effect. So here I am with my consent form. Everyone should fill one of these out and have their blood pressure taken before treatment. The main contraindications to be aware of are that you don't have any cold intolerances, local blood flow disturbances, acute respiratory or lung diseases, and that you don't have any hypothyroidism or diabetes. After you've filled out your consent form and everything is okay, you will then be given woolly gloves and socks, and then you're ready for treatment.
Okay, so the consent form is now filled out, so let's go to the treatment. Ready for treatment? Okay, so shall I step straight in? Step straight in, and then go. -120 to -140. You can see the temperature there if you...
Yep.
We're already getting a bit nippy. Things seem to be disappearing. Cold. Bit nippy, but all the bodily responses are going to kick in. So we're going to get that vasodilation, which will be at its height after 4 minutes post-treatment after cryostimulation. At this window, it's always more productive and more efficient for the results and the therapy to combine this with some kind of kinesiotherapy or exercise if we're talking about muscle recovery. So getting onto the bike after a treatment for most athletes is the next step. Go 50-50. Warm it up now. So after cryostimulation, although we're using extreme cold vapours, because it's so dry, it doesn't penetrate the tissues, which is why I don't really have goosebumps right now. I don't feel really cold. And I would feel this way if I just got out of an ice bath. What I am actually feeling is everything starting to heat up. It's like a mentally sensation. Almost feel a little bit lightheaded, elevated mood, and yeah, just kind of everything starting to feel a bit warmer. By doing more exercise, we're increasing blood flow further, which is further going to improve that reduction of toxins and detoxification in the body. And we're going to pump more blood to the area, which is going to increase rates of healing and really help with recovery. Okay, so 3 minutes are up on the bike. Now I can hop off. Let the processes of the treatment take effect for the next several hours and get changed. Thank you for watching the video. If you have any further questions on cryostimulation, please let me know at Luca Dorigo on my Instagram page. Alternately, I hope you found the video educational. Like, comment and subscribe and let me know what you think.